I'm 40 years and I have cracks in my foreskin. Yes. Yeah, this is a fairly frequent issue with which young men come to our OPD. And when a young man says that he's finding it difficult to bring the skin back and is finding that there are cracks in the foreskin, then there are two or three things that automatically come to our mind. We do ask them if they have a family history of diabetes, or indeed are they diabetic. If there's a strong family history of diabetic and they have never been checked recently for diabetes, then that's something that we do suggest that they get evaluated with. A fasting blood sugar, a post-lunch blood sugar, maybe a test called HbA1c to see how the sugars have been over the previous 3 months. A urine examination could help rule out diabetes. If it's indeed a diabetes, because that's actually one of the pretty common presenting features of diabetes in a young man, then a good sugar control usually takes care of this issue. If a patient has already been a diabetic for several months and still has these cracks, then we check if the sugars are under good control. Lack of sugar control generally is indicated by the presence of cracks in the foreskin. And thirdly, and this is something that we've been seeing very commonly, sometimes the medicines for sugar themselves cause this kind of issue. There are medicines called SGLT2 inhibitors. There are medicines called dapagliflozin, empagliflozin. Patients take these medicines, they find that their sugar levels are excellently well controlled. But what we've seen is these medicines cause the blood sugar to be under good control because they cause the kidneys to be excreting the sugar in the urine, and therefore the bacteria in the urine tend to find it an excellent medium to grow, and they flourish and cause these kind of cracks. So in such circumstances, we would want the patients to be taken off the medicines like dapagliflozin. We probably would give them some antifungal medicines and see if things get better. Quite often things do get better. If things don't get better, then we would probably want to do a repeat evaluation and perhaps a small surgery is required.